My name is Linda Irizarry. I'm a Special Projects Coordinator with the District of Columbia Department of Aging and Community Living, also known as DACL. The District of Columbia Department of Aging and Community Living is excited to partner with the Office of Paid Family Leave. There are three types of paid family leave. There's parental, medical, and family. Today, we want to explore more resources related to family and medical care. DACL services and supports. DACL provides a variety of programs and services to support unpaid caregivers to our seniors and adults with disabilities. These programs and services range from caregiver respite to support groups to educational programs to case management. You're not alone in your journey. DACL is with you. DACL support and educational groups. This May, DACL launched a caregiver support group in response to the COVID-19 pandemic. The goal of the group is to provide a safe and supportive setting for the district's family caregivers. This group meets twice a week, Tuesday 11 a.m. to 12 p.m. and Wednesdays 4 p.m. to 5 p.m. via conference call. The caregiver support group discusses various topics such as losing emotions of caregiving, using a relationship map, which is a great person-centered tool that is a visual diagram that allows you to see a broad view of connections and is used to discover and think through paid and unpaid supports. Also, we discuss fall prevention tips, how to keep your loved ones safe at home and reduce the risk of falls. A main thing that we discussed in the group is that the importance of taking care of yourself and that the caregiver's journey is one day at a time. Another offering that we have is the Savvy Caregiver Program, which is a great 6-week series delivered in 2-hour sessions that help to develop the knowledge, skills, and attitude to caregive for those who are age 60 and over, adults with disabilities age 18 and older, and who are living with Alzheimer's disease and related dementias. And now we'll discuss 8 self-care tips for the caregiver. Tip number 1, manage your stress. Way easier said than done. However, when you start to feel stressed out, find an activity that works for you and do it for a few minutes. Here are some activities that you can practice. Meditate. This is perfect for you as a caregiver because it's free, it can be done anywhere at any time, and is a proven way to reduce your stress. Breathe deeply. As a caregiver, you know there are moments where your frustration, your anger, and anxiety will spike to overwhelming levels. When that happens, breathing deeply is your best friend. It forces you to pause and calm down so that you can better deal with whatever's happening. Also, journaling, writing out your feelings, tracking your accomplishments, always seeing what you've done over time is a great way to help reduce stress and give yourself a pat on the back, which you deserve. Also, journaling can be writing ideas and thoughts that come to your mind. Prayer is another thing. Connect with your higher power. Practice yoga. Listen to music. This is a great way to boost your mood, lower your blood pressure, reduce anxiety, and many other things. So next time you're feeling stressed out, play your favorite tunes. Lastly, find something to be grateful for in the moment. Being grateful does reduce stress. Studies show that practicing gratitude can make you happier, lower stress, protect you from depression, improve sleep, and boost your immune system. Reducing stress is a great way to prevent caregiver burnout. Tip number 2, exercise. Exercising for at least 10 minutes can reduce stress and promotes better sleep, reduces tension and depression, and increases energy, alertness, and endorphins, which is a good coping hormone. If finding time to exercise is difficult for you, try to incorporate it into your activities of daily living. Perhaps stretching with the person that you care for, or even walking in place. Regular exercise helps protect you against conditions that commonly plague caregivers, such as depression and heart disease. Looking for a free exercise class? Well, check out DCTV and Around Town DC. Tip number 3, eating healthy. Eating a balanced diet is not just good for your physical health, but your emotional health as well. In the short term, eating properly can help boost energy levels and reduce sluggishness, while in the long term, eating well can reduce the risk of cancer and heart disease. Something to keep in mind, have healthy snacks on hand. Making sure our bodies get the important nutrients needed can be challenging when you're very busy as a caregiver. However, you can set up yourself for success by having healthy options ready. It could be an apple, some nuts, or even if you have the luxury of meal prep. Try to drink 6 to 8-ounce cups of water a day. Remember that little changes can make a difference. Sometimes we can get overwhelmed by the huge goal of eating healthier, and you don't know where to begin. Remember that small changes can lead to big changes, so pick one thing that you would like to change and start from there. Tip number 4, ask for and accept help. Everyone needs help from time to time. However, as a caregiver, you may be tempted to try to handle everything on your own. This will cause you to feel burned out faster. You can't do it all on your own. Accept the help when someone says, "Is there anything I can do?" And prepare a list of ways that others can help you. And let the helper choose what he or she would like to do. For instance, if a friend or family member may be able to run an errand, let them do it. Maybe pick up groceries for you, or cook for you, or drop by and deliver a meal. Don't feel guilty for accepting help. Also, it's okay to accept help from community resources such as DACL, faith-based organizations, and other professionals. Trying to figure out who to ask for help? Use a relationship map. Please don't wait until you're overwhelmed or exhausted or your health is failing. Reaching out for help when you need is a sign of personal strength, not weakness. DACL is here to help. Tip number 5, attend to your own healthcare needs. When you're busy taking care of someone else, it's easy to put your own medical needs on the back burner. However, take care of your health. Do a virtual telehealth visit or consult with your healthcare professional for routine exams, or when you're feeling ill or when you have a concern regarding your health. Put you first. Tip number 6, leave the guilt, forgive, and laugh. Caregiver guilt is real and can lead to misgivings and second guessings. Did I make the right decision? Should I have done this? Should I have done that? Always know you're doing the best you can. Forgive yourself often. You can't be a perfect caregiver all day, every day. Accept the fact that you can't control everything and that caregiving is a journey. Laugh and find positive moments. Find ways to keep your sense of humor on a daily basis. Laugh at the small things. Laughing in caregiver moments helps lighten the mood and reduces stress for both you as a caregiver and the person you're caring for. Things may not go as planned, however, find the positive moment out of all of it. Watch comedies, practice laughter, exercise, and share jokes with friends. Tip number 7, take a break. You can't pour from an empty cup. Taking a break can restore your perspective. Respite, which is a break from caregiving, can help you as a caregiver restore balance in your life. It allows you to take time to recover from stresses of caregiving and gives you the flexibility to take care of other important aspects of your life. Respite care is a necessary tool to support you in your caregiver success. Make a deliberate effort to take respite. This could be for 15 minutes, an hour, or a day, to just do something not related to caregiving. Some ideas could be make a date to do a virtual movie or paint night, read a book, or close your eyes for 5 minutes and notice each breath you're taking, even take a nap or take a walk. You can do adult coloring or gardening or develop a new hobby or just do nothing and relax because you know what? You deserve a break. Tip number 8, get support. Getting support can come in various forms. It could be attending the DACL support group or the Savvy Caregiver program class. It could be have a buddy that you can call just to let off steam or vent or let out your feelings and emotions. Also, getting support, like we said, can be a support group, which is great because it provides validation and encouragement, as well as problem-solving strategies for difficult situations. People in support groups understand what you may be going through. A support group can be a good place to create meaningful relationships. If you're feeling that you need to talk more about the range of feelings and emotions, seek professional counseling. Just know that caregiving is a journey. Take it one day at a time. And most of all, take care of you. If you'd like to join the DACL support group and or the Savvy Caregiver program, please contact me at 202-355-4443 or at linda.irizarry@dc.gov. Also, contact your health professional. They're there for support, and that helps you to take care of you. Get a checkup. Please contact our information referral and assistance line Monday to Friday, 8:30 a.m. to 4:30 p.m. to get information on services and supports. Their number is 202-724-5626. And I'd just like to say thank you to the Office of Paid Family Leave for curating Wellness Wednesdays and for having DACL to be a part of this. Also, thank you as the caregiver for all the work you do every day, and please stay safe.